Hi, good afternoon. My name is Claudia Estrada, and welcome to my nonprofit partnership proposal between the City of Barstow and Inland Regional Center. This will be designed to advance services and social inclusion for individuals with developmental disabilities in our community. We propose a formal collaboration between Barstow and IRC. It's aimed at expanding access to essential services and promoting community integration for residents with developmental disabilities. The centerpiece of this effort is to jointly administer a community inclusion program. The background to this: Barstow is characterized by significant population diversity, including a considerable segment of residents with developmental disabilities. Despite IRC's designated role in service provision, substantial gaps do remain. The data does indicate that approximately 8% of local households are still affected, yet many remain unaware of the available resources to them or unable to access them. So the goal also behind this is for families to know that Inland Regional exists, what they do offer to families, and that it is offered in Barstow. There is also help with additional resources to get to and from if a kiddo needs to be sent, for example, a psych evaluation. That could be taken in Redlands. Inland Regional does provide additional resources for traveling to that appointment if requested. So, individuals with developmental disabilities frequently encounter obstacles related to service accessibility, information is diffused, and community participation. This often results in social isolation and services not being utilized. And existing resources not being utilized. In the absence of this being coordinated, localized response, and these inequalities are projected to persist if there's not an outreach to the community in regards to these resources. When it comes to stakeholder input, through consultation with advocacy organizations, educational professionals, for example, it could be the school districts, and families with critical needs have been identified, namely improved resource navigation, greater inclusion in recreational activities, and enhanced transportation services. So some of the primary objectives of this partnership are to broaden access and support and resources, foster social inclusion, strengthen coordination between the city and IRC, and empower families and caregivers within the community. Some of the expected outcomes with this inclusive community program is it's anticipated for measurable improvements, including 30% increase in the IRC service utilization in the initial year, a minimum of 2 community events per month, enhanced quality of life for participants, and the establishment of sustainable collaborative service delivery. When it comes to the program description, the proposed community inclusion program will feature a dedicated liaison stationed at a city facility, regularly scheduled workshops and events, peer support groups, coordinated transportation solutions, and cross-training initiatives for staff members. When it comes to evidence and model, empirical evidence supports collaborative models are effective, meaning to improve service delivery outcomes by integrating locally based staffing and consistent community programming. We do expect to facilitate greater access and inclusion. The program is designed to inform by agency theory and principles of stakeholder engagement. When it comes to the budget overview, the project budget for this initiative is $80,000, sourced from various types of. Some of the fundings come from public funding, IRC contributions, and grant support. Major expenditures include event programming, facilities, staffing, and materials, all structured to ensure program sustainability and impact. When it comes to sustainability and risk mitigation, sustainability strategies include pursuit of additional grants, shared funding responsibilities, and integration with the city's long-term budget planning. Some of the potential risks such as staff turnover and transportation barriers, these will be addressed through cross-training, establishment of advisory board, and flexible transit arrangements. When it comes to the evaluation plan, the program's effectiveness will be evaluated through periodically. Periodically, the participant and family surveys, monitoring of service utilization metrics, and annual reviews. Findings will be included and will be shared with stakeholders and used to inform continuous program improvement. In regards to Inland Regional Center and who are they? So Inland Regional Center currently does serve 37,000 individuals in 2 counties, specializing in advocacy, case management, and comprehensive service coordination for those with developmental disabilities. For example, in the evaluation plan, it does mention checking with the family periodically. The service coordinators do check quarterly with the family every 3 months. Um, and all the services are laid out for the family, what is being offered, how many times a week, etc., etc. So this will be one of the things that families will be offered is that individualized family service plan that is offered to all the families in early start, and there'll be different plans depending on the age, the disability, etc., etc., because every kiddo is different and has different needs, and adults, etc., etc. So the policy alignment. This initiative aligns with mandates of California's Latterman Act and supports a broader state and local objectives for disability rights and social inclusion. Also, I would like to add it's very important um, to also educate our families on what California's Latterman Act is and what it falls under. So, the Latterman Act, those who are qualify under this Latterman Act do go through a process of eligibility review, and eligibility is based off autism depending on the severity, epilepsy, cerebral palsy, intellectual disability, and fifth category, which is, for example, Down syndrome. And it's just educating families on if there is any concern, you're seeking any services, and your family member has this one of these diagnoses, please seek these services with Inland Regional, because there could be services that are offered, resources that you can seek with them, that or even a case coordinator leading you or directing you to the right place that can offer additional resources if Inland Regional doesn't offer it. So, in summary, the evidence informed partnership model does address critical service gaps, addresses critical service gaps, promotes social inclusion, empowers stakeholders, and establishes Barstow as a leader in collaborative, accessible community services for those in Barstow. I hope that this was informative enough of a proposal for Barstool to consider a partnership with Inland Regional and extending the additional resources and educating those in Barstow that can possibly use these services and know that these services are available to them, and there's additional resources within their city or additional resources to get them from or to these additional services if they are seeking them. I think that's one of the main things of this partnership is letting families know that they have this at their um, disposal so they can go ahead and use it for their families. Again, those are seeking all the early intervention services that are provided for free, and families knowing, hey, some of these infant specialists go out to your home. You don't need to drive anywhere, and it'll provide those services or address those concerns that you may have for your infant, or maybe the pediatrician mentioned um, some concerns and you don't know where to go. You can submit an application as easy in 5 to 10 minutes through the Inland Regional website, and they can do an assessment. It could be done virtually, it could be done in your home. It could be done if you're willing to drive down, or depending where they have it in clinic. I'm willing, the family knowing that they have that, so they can be able to advocate for their children, knowing how to advocate for their children, or family members, or individuals that they may know that can use these services. So, in regards to everything that I did include in this proposal, I do have my references in the last page. But again, thank you so much for listening to my proposal. And my name is Claudia Estrada. It was really nice speaking to you.